Okay, I'm going to begin now. So just to inform everyone that this webinar is live and recording, and the recording will be posted to the My IVF YouTube channel after completion. And welcome to the My IVF Answers platform and the European Fertility Society, which has been created to support, raise awareness and educate patients struggling with fertility. I'll be speaking about IVF/ICSI with Own Eggs at Memorial Hospitals Group. This event is anonymous, so I can see your names, but no one else can see your names. So any questions that you may have, please just put them down the side in the chat box, and I'll be able to see those and answer those at the end as well. So if at any time something comes to mind, please feel free to use that chat box. And if the questions are a bit longer, don't worry whatsoever. I'll be more than happy to address those. If there are questions that come to mind afterwards, of course, my details will be presented at the end, so you'll be able to reach me directly as well. So I'll just start with talking a little bit about myself. So my name is Roza Mrozowska. I've been with Memorial Hospitals Group for a year now, and I've been the IVF lead for 6 months. So I've dealt with all incoming inquiries, supporting any patient and patient questions, and being the direct link between doctor and patients. So questions and just running through the whole process as well. It's been massively rewarding, a little bit challenging, but I know there's still lots to come, lots of great things to come as well. And I'm just really pleased to have this opportunity to share with you what we can offer and make IVF maybe a bit more accessible. And also, just if you've not been through IVF before, this is a great starting point. And if you have been through IVF before, it might be nice to just see what else is out there as well. So I'll just put on the presentation now. You won't be able to see me, but you'll be able to hear me, obviously. So I'll just pop that on. There we go. So the presentation should now be on the screen. So as I mentioned, this will be our topic, IVF ICSI with Own Eggs at Memorial Hospitals Group based in Turkey. So in about 20-25 minutes, these are what I'm going to go through. So about Memorial itself, our suitability requirements, the treatment process, hospitals and staff, patient care and satisfaction, and pricing information as well. So a little bit about Memorial. Memorial was established in 2000 in Turkey, and it was began with Memorial Şişli, which is one of the hospitals I'll be speaking about further on. It's a multidisciplinary complex of hospitals. So it's not just IVF based. We also deal with orthopedics, complex brain surgery patients, stroke rehabilitation. And more recently, we've been well known in terms of health checkups. They've become very popular with us. And indeed, it's been nice to share people on that journey as well. And it's important for Memorial to have a UK office to support UK patients because we understand the landscape and the framework of where UK patients are coming from. And we also understand why overseas travel for medical care might be a bit daunting. And we're just there to support you all the way. I like to say that we are the bridge that are here to support you before, during, and after. I've also done some research on the IVF space in the UK, and it's a fact that NHS funding is going down. for IVF, and GP appointments are hard to get in any domain, but especially IVF, and the waiting times can just make things feel so impossible, which is another reason why Memorial is a great option to consider. So if you were thinking about IVF with Memorial, what would the process look like? What would the steps be? Well, the first thing would be to contact the UK office, and you'd most probably be speaking with myself, whether that's on the phone, through email, or through WhatsApp. If not, it'll be one of my colleagues who'll be more than happy to talk to you. So the first step would be to have a honest and in-depth conversation about medical records, details, whether it's struggling with undiagnosed infertility, recurrent pregnant loss, failed IVF cycles. Those details are really important for us to gather, as we then share those with our medical team, who I will show in a couple of slides. And they'll evaluate all the results that you have, whether it's a low AMH number, whether it's sperm analysis problems, or whether there's no root cause, up to which they will suggest next steps, whether it's further blood testing, whether it's a specific type of scan. There are some initial tests that are helpful to have to begin looking at a couple's fertility, which I will also explain shortly. After the step of the evaluation, there is an online consultation with the doctor. That's about 10-15 minutes, and they'll run you through the process, the personal next steps for yourself. And then if all goes well and all is ready to go, we can book your treatment and make the arrangements. And then you join us in Turkey and we get started with the treatment. So now a note on our suitability. The patients must be a heterosexual married couple. This is required by state law. Both patients must also be able to travel to Turkey. The female patient must be on or under 30 BMI and under 45. And these are the results that I previously mentioned that are the starting point for looking at a couple's personal fertility. So you've got AMH, which is a blood test, and that tests a woman's ovarian reserve, and a HSG scan, which is a scan done with contrast that informs the team, the clinical team, as to whether there are any blockages in the tubes that may also be causing the sperm not to travel to the egg. And for the male patient, we require a sperm analysis. So this is to test motility, mobility, the number of sperms available as well. So these tests, you can get them done in the UK, and it is usually what I would recommend. However, we are also able to do these in Turkey, and I'll be explaining a little bit more about that shortly. So what would the treatment process look like with IVF if you are unfamiliar? So it begins with ovarian stimulation with medication. So the woman is given regular medications and monitored throughout. This is to mature as many eggs as possible to increase the chances of a successful reproductive cycle. And then around 2 weeks after this process, a trigger injection is used to mature the eggs, after which the eggs can be retrieved. Then the eggs are fertilized, and this is done either with traditional IVF or ICSI. The difference between IVF and ICSI is one minor detail, to be honest. So with IVF, the egg and the sperm are put together and they fertilize like that. With ICSI, the sperm is injected, one healthy sperm is injected directly into the egg using a micropipette. So in cases where male infertility might be more of a determining factor, couples will often be suggested to go for ICSI. But again, this will all be discussed with the clinician as to which route would be best for you to take. After the egg, which is now an embryo, reaches blastocyst stage, so it's fertilized, it's growing, it is then transferred back into the womb to grow. So this is just a rough process. The treatment process might be different for every individual couple. IVF is very personal. So this is just a rough baseline, but we do always suggest to have at least 21 days spare for the treatment. So these are the hospitals and staff that I'd like to speak about when we talk about IVF treatment with Memorial. So we have Memorial Bachelevler and Memorial Shishley, both which are JCI accredited. And we have Memorial Ataşehir, which is a baby-friendly hospital certificate holder. Both Memorial Bachelevler and Shishley are on the European side of the Turkish continent, and Ataşehir is on the Asiatic side. Associate Professor Arzu is a specialist in reproductive endocrinology, so that's to do with thyroid hormones, and she's been a qualified doctor since 2004, so she's just passed her 20-year tenure. Professor Semra Karaman, is a pioneer in ICSI, and she was actually the first to have IVF success using ICSI. And she's also been an incredible pioneer in advanced pre-implantation genetic diagnoses. Professor Ebru has experience in gynecological endoscopies, so great with diagnosing potential infertility factors, and she's incredibly dedicated to patient care. I've worked with Dr. Ebru closely over my time, and she's always very, very calm, and she's always got the answers to the questions that you need, and she asks you questions back as well. She really likes knowing everything, so she can give you the best opinion and tell you everything she can. So I think everyone, it's no secret that IVF is stressful and it is challenging for a number of reasons, especially with timings, and this has to be then and this has to be then, and all over the place. But as the UK office, we strive to minimize that as much as possible. We want to be as helpful as possible. So we are in direct communication from the first moment that you put through an inquiry with myself. I am your direct line of communication. If for whatever reason it has to be someone else, they'll be just as committed to you as I would be. And it's, even something as simple as traveling for a checkup, we handle with the utmost care. And something like IVF and ICSI, we want to make sure that we're taking care of you as best we can to limit the amount of stress that you're under. Before you travel out, we create a WhatsApp group, so we'll be in constant communication for your arrival. And then at the hospital as well, all the hospitals have free Wi-Fi, so you'll always be able to reach us through WhatsApp then, and at your accommodation as well. The coordinator/translator that will be assigned to you will always be by your side as well, and you'll be able to ask them any medical questions that might come to mind as you are maybe waiting to see the doctor, or maybe you're in the hotel and something feels a bit funny. You'll be able to reach them immediately. I'd just like to share a quick video of a patient review of Martina from Italy. So I'll just play that now.
Merhabalar, ben doçent doktor Arzu Yurcu, Memorial Bahçeli Evler Tüp Bebek bölümünde çalışmaktayım. Martina daha önce İtalya'da 3 kez başarısız tüp bebek denemesi olan 37 yaşında azalmış yumurta rezervi olan bir hastamızdı. Bize geldiğinde oldukça üzgün ve mutsuzdu. Tüm umudu kırılmış, hatta İtalya'da bir daha deneme yapmaması kendisine önerilmiş bir hastamızdı. Bize başvurduğunda ayrıntılı bir şekilde inceledik. Sorunun ne olduğunu tespit ettik. Problem çözebileceğimiz alternatif yöntemler neler olabilir bunları inceledik ve ilk denememizde 2 tane embriyo transferiyle mutlu sona ulaştık. Bugün 12. hafta oldu. Cinsiyetini söyledik, prensesimiz oluyor diyerek mutlu bir şekilde kendilerini memleketlerine yolluyoruz. Yurt dışından bize oldukça çok hasta başvuruyor ve çoğunlukla ümitsiz bir şekilde geliyorlar. Ama şunu söyleyebilirim ki merkezimizde ileri teknikleri kullanarak yapay zeka dahil olmak üzere iyi bir laboratuvar altyapımızda mutlu sonuçlara ulaşabiliyoruz. Herkese sevgilerimi gönderiyorum.
Ciao, sono Martina, ho 37 anni e sono italiana. Siamo venuti qui tramite un'amica della ginecologa, la dottoressa Arzu, che ci ha accolto. Abbiamo iniziato il trattamento a marzo, aspettiamo un bambino. Ora aspetto un bambino, sono alla 13ª settimana, sono un pochino emozionata. Ci accolgono ogni volta con un sorriso, dall'infermiera alla ginecologa alle traduttrici. Mi trovo bene e consiglio il Memorial a tutti quanti e spero che possa portare fortuna anche ad altre.
Yep, so that was just a short video. I really enjoy that video because I like that she says everyone welcomes us with a smile. I feel like that's the easiest thing and the nicest thing. And it's definitely something I experience whenever I'm around the hospital as well. So the final part of what I'd like to cover is our pricing of the treatment itself. So this is our standard package, and the cost is £3,600. So this includes hormone testing and ultrasound examinations after beginning of the medical treatment, so the ovarian stimulation as previously mentioned. The egg collecting procedures, egg freezing if necessary, anesthesia, medical and medication costs, embryo transfer procedures, and airport transfers. An important thing to note is most IVF or ICSI treatments do have the medication as a separate cost, and there's usually a guessing game of how much it might cost because of how much medication might be required, might not be required. At Memorial, we decided to remove that factor of it and just make it one price, so there's less worry about how much it will ultimately cost. And this package doesn't include the pre-treatment testing, so no blood tests, no AMH, no sperm analysis, and no HSG. And these are required before starting IVF treatment because the doctors want to have the clearest view of your fertility at the stage when you want to prepare and when you want to go ahead with the treatment, so those are necessary. The second thing that we offer is our all-inclusive package. This includes everything that our standard package includes, including accommodation for 20 nights, and will also cover any minor interventions if necessary. The quote for this package is £6,900, and this also includes pre-operational testing, so the blood, the hormones, ultrasound, sperm analysis, and HSG. I would recommend this for persons who may have older test results. Maybe the sperm analysis is a couple of years old. The hormone tests maybe have been done a little while ago as well, at which point this would be a great package to have all the updated results, go through with the treatment, and have accommodation as well. At which point all you would really need to worry about, and what we would, because we'd arrange everything, is just flights and letting us know when you land, with that airport to hotel transfer sorted by us as well. And as mentioned, we'll be in communication the whole time. So if the flight's delayed or maybe something has changed, we'd be happy to sort of rearrange and help when we can. The final thing I'd like to mention is the egg freezing is mentioned here. So if the eggs are retrieved and something changes and there has to be a break in the treatment, the freezing is covered for a month's duration. These are just my details really quickly before I jump to the questions. As you can see, my full email and the UK office email as well, both the office and my number. And there's a QR code there so you can scan and message me directly right now if you would like. So that was the presentation in its totality. I hope it was informative, and if there is questions, I know there's a couple questions that have come in, please don't hesitate to put those in and I'll be more than happy to answer those as well. And as mentioned, it is all anonymous, so don't worry about sharing if there is something you would like to ask. So there's a question here. I would like to know if in this clinic there is an age limit. Yes, there is. The clinic is 45, and if it's accessible for single women. Unfortunately, it is for married couples. In terms of receiving the presentation, it is recorded and it'll be uploaded to the My IVF Answers YouTube channel, so you'll be able to find it there. There's a playlist, Meet the Clinic, and it'll be available there. In terms of PCOS patients, so PCOS is obviously quite a difficult thing. So that would be at the moment where you share that with the clinician right at the start, any medical records that you have and how you are going ahead with it, and the information. And then if they'll be able to further diagnose where the infertility is coming from. This is more from a medical standpoint, so I can't share much, but all I can say is the more thorough you are with your clinician, the more they can help, the more they can suggest, and they'll always give you options for what you can do, whether it's here on the NHS, whether it's in Turkey. That's always what they want to do. They just want to help you 100%. Genetic testing, so that goes back to the other way, to the other answer. That is usually suggested for older couples or for couples with recurrent pregnancy loss. But again, that will be shared from a medical point of view from the clinician. There's a question about pre-genetic testing and the costings. I currently don't have the costings of that, but it's definitely something I can share further down the line if you get in touch with me. Same question about the embryos. Not Not sure. That'll be down to the clinicians as well. Do your packages include flight and accommodation? How can I get a PDF document? So our all-inclusive does include the accommodation, and we don't include flights, but we are able to help with that if required. And this will be shared with you as well. And you can get in touch with me for this presentation if you'd like it just as a document. And then we have a document that outlines everything as well that we do share with patients. When do you advise to have IVF? After what age? So there's no right or wrong time for IVF. I wouldn't say. I would say if there is infertility problems that you are experiencing, and maybe they have a root cause, maybe they don't have a root cause, there is no right or wrong time to explore those things. In terms of success rates, those are in process, just as we've just left 2024 even, and we've entered 2025. I haven't been able to gather those. There's 3 different hospitals with 3 different success rates. But I am in the process of getting those, and I'll be more than happy to share those with any patient that gets in touch with me. The all-inclusive package includes the transfers from the airport to the hotel, and we recommend that the hotel is near the hospital. We can't arrange those transfers just because you might be going more, you might be going less, and it's usually less stressful not to wait on a car to come, to be told at a certain time. It's easier just to make your own there in your own time and make it work for yourself. So there is a consultation included. The question here, can we have a consultation with one of the doctors before traveling? There is a consultation included after all the results are evaluated, just to bring clarity to the process. If the first attempt is unsuccessful, we do offer reductions in a extra cycle. We're more than happy to discuss that further down the line. But usually that's sort of not talked about in first steps because we all want that first attempt to be successful. A question here about a lady who is 43. I can't share as that's more on the medical side, but if you do have previous fertility results testing, we're more than happy to share that with the medical team. Something I did want to mention as well is our communications with the medical team are completely free. They're called medical secondary opinions. And we do offer them for more than just IVF. On having eggs frozen in the UK and bringing them to Turkey, I'm not sure on that one. I think there is some leeway, but I'm not 100% sure. So I'd have to do a bit more research and checking in with the hospitals on that one and the labs as well. To proceed and get in touch with the doctors and the medical team, you can get in touch with me and I can share everything across, or with anyone in the UK office. You can find our contact details online. If you just look up Memorial Hospitals Group, you can put through an inquiry and that'll get sent through to us. Or we have our Leeds office as well. So if you look up Memorial Hospitals Group UK, potentially Leeds, that'll come up as well. Something I did want to mention is obviously since joining the IVF space, I've been wanting to learn more and more and more. And I know that one thing about IVF is the uncertainty of it. But I think it's nice. You gotta try. And always looking for the best methods, best specifics. I know looking into the NHS and what the NHS offers and what clinics in the UK offer mild IVF or natural IVF. There's loads of different routes to go with IVF, which is why it's so important to have all those medical records and all that medical information and all of that pre-testing. Sometimes it's not an open and shut case. Sometimes it needs more investigation, which is absolutely fine. Sometimes it takes a little bit longer, but the end goal is something truly remarkable. So we're happy to go on that journey with you, so to speak. So I'll just wait, I think, until 22 for any final questions, and I'll pop up my details as well, just here. Remove that. Just here. I'm hoping everyone can see the presentation with the details. I'll pop them in the chat as well. So that is my personal email, and that's our office email as well. So if I miss it, someone else in the office will be able to pick it up. We've got another question. So a question here about the hospitals. As mentioned, 3 different hospitals, so Memorial Bachelevler, Şişli and Ataşehir. All 3 great facilities in different areas of Istanbul as well, depending on whether you like it a little bit busier, a little bit quieter. And as mentioned, Şişli was actually the first memorial hospital, but they have modernized it. They have brought it up to spec, and it is with that JCI accreditation. And the following question after that one, how do you choose what facility is best for each case? So as I mentioned, our lead doctors all have different specialisms, and we can, once the medical data from yourself is shared, part of my job is to match it with the right clinician. And if that clinician thinks someone else needs to take a look, they can. It's very much, each department is in touch with each department. They all want to find the best person for the job, the best answer in the case. So I will sign off here. Thank you so much for joining me tonight, and I hope this was helpful. I'll just, for the final time, pop my details on. If you want to get in touch, please don't hesitate. And I look forward to hearing from you, and this presentation will be available on the YouTube channel for everyone to view. So thank you so much, everyone. Bye.